Welcome to GatewayC Live, Greater Manchester. Fast facts, supporting earlier and faster cancer diagnosis. Cancer symptom recognition. Think A to G. Our specialist is Dr. Joanna Bircher. A. Access support from colleagues.
So especially for those of you who might be relatively new to this kind of frontline primary care role and feel like you ought to know everything, nobody knows everything. I talk to colleagues and ask people things all the time, and it's absolutely fine to do so. So if you've got a kind of a reception manager or just if it's a GP walking through the reception and they look like they've got time for just a quick chat, can I pick your brains about this? I've just heard this. That the more we talk to each other, actually, the more likely we are to do the right thing, because you've got two heads working on a problem and not just yours. So yeah, please do that and try and set up the systems in the practice where you have a chance to have those conversations.
B. Bumps, lumps and unexplained bleeding.
New lumps appearing somewhere on the body or moles that have changed. Our frontline teams, you're all really kind of familiar with that kind of thing yourselves, and you tend to get those people through to access care quite quickly. Certainly with the mole changes, most practices have got access for patients to send photos in, which I think is really, really good at getting prompt care. And also bleeding from somewhere they wouldn't normally bleed from is quite a useful marker of a symptom. If you're coughing up some phlegm and there's got blood in it, that's an alarm bell. I think that could be a cancer. And blood in the urine, blood in the stools, these things you would really recognise.
C. Consider hard to reach groups.
Well, we do worry about people who don't normally see doctors. And then they've come with what sounds like a significant symptom, because they're normally self-care for all the minor things that get better by themselves. So if it's gone on long enough for them to access a doctor, particularly if they've taken time out of work to do that, then that rings a little bit of an alarm bell. And men are much harder to get into the doctors with symptoms in statistically. So when they present with a new symptom, we perhaps worry a little bit more. And people who come repeatedly about the same thing, or maybe you're taking phone calls, and there may not have been a slot that you could put them into that day, and then they're phoning back the following day and the thing obviously isn't getting better. I'd say maybe use that as a little bit of a worry sign as well. Or people that are coming to different appointments with different clinicians. It's been shown on research that if you see the same clinician each time with your symptom, you're more likely to be picked up sooner that this is something that could be a cancer. We worry about those people who struggle to access care. So, people who maybe have problems with addiction or homelessness, or English isn't their first language, or who don't necessarily know how best to navigate healthcare systems anyway. And when they have a symptom of concern, they often present late. So if they've come to you, grab them while you can, make sure we've got the right kind of language line or whatever available to make sure that they can be seen promptly. Reception staff often get approached by family and friends of somebody. So a patient that's registered who might have some worrying symptoms going on, but because there's something about a fear of having a cancer which can put people into a kind of denial mode. If I don't say to anybody, if I don't present it won't really happen, even though in the back of their mind they'll know that's not true. We'll all know, and you'll all know patients on your list that are like that, but it's their family or friends that might come or might phone, and then you're in a slightly awkward position, because clearly without the consent of that person there's not a lot you can do other than maybe alert the clinician that who normally looks after them that this concern has been raised, and then they'll have a think. You can get your heads together about what might be the best approach to encourage that person to come in, within the realms of what's ethical.
D. Don't be frightened to be wrong.
Bowel cancer is one of those ones that we can pick up early if we've asked the right questions in the clinical assessment. So don't feel like you shouldn't, like Sarah was saying before, don't feel like you don't want to get it wrong and put them in for an appointment when it was just piles and you should have sent them to the chemist.
E. Early diagnosis saves lives.
A key message I want to get across today is that the earliest we pick up cancers, the more curable they are. So you will actually save lives by really recognising people that have got that have got symptoms that could be cancer.
F. Follow your gut instinct.
Don't be frightened about a gut instinct. Because I know it's certainly true of clinicians like GPs that their gut instinct that somebody's got something more serious going on, like a cancer, is as powerful and useful statistically as all the different guidelines that have ever been published that are hunches. And I don't see any reason why that can't also be true of people who work on reception in primary care. I think you will have a gut instinct when you see somebody who's looking unwell, because you'll have seen them over time, or you'll be hearing things. So don't be frightened to rely on that gut instinct.
G. Greater Manchester Referral PROFORMA.
These are the standardised ways in which, when we think somebody might have a cancer, that we pass on that information to the teams who will then be dealing with it and will be contacting the patient for an appointment. So they're referral proformas, and they're sent via the electronic referral system, ERS. And many of you who are working on reception units might also deal with referrals and be really familiar with these, at least as familiar as I am. Sarah and her team are involved in tweaking them to make them as useful to us as they can be, and they've certainly become a lot simpler recently. They give really important information also about whether translators are needed and whether somebody has capacity, because the team up at the hospital need to know that to be able to process it properly. And it also has some guidance on who should be referred on those forms that's actually embedded in the form, which is really useful to clinicians. So they're all standardised, and they're different for each particular cancer that you're looking for. So generally embedded into medical systems as well in most places. So worth getting kind of familiar with them, because you may be helping locums who come into the practice who may have even come out of Greater Manchester area.
Think A to G. A. Access support from colleagues. B. Bumps, lumps and unexplained bleeding. C. Consider hard to reach groups. D. Don't be frightened to be wrong. E. Early diagnosis saves lives. F. Follow your gut instinct. G. Greater Manchester Referral PROFORMA. GatewayC Live, Greater Manchester. Fast facts, supporting earlier and faster cancer diagnosis.